Hello, and welcome back to Designing Care on Air. This is Elizabeth Johnson from Montana State University, and today I am joined by Dr. Bernadette McCrory, who is an assistant professor at the Norm Asbjornson College of Engineering here at Montana State. Dr. McCrory has done an amazing, incredible job of building not only our healthcare systems, industrial, mechanical, but now biomedical. Dr. McCrory, thanks for joining us today. We'd love to hear about your background.
Yeah, thanks, Liz. So my background is truly multidisciplinary. I've had the privilege of getting a biomedical engineering degree from a university. We were the first accredited class, so it was a pretty pioneering route through that with a focus in biomechanics, which was really interesting. Then I decided to go to grad school rather than med school. It was kind of a normal route for half of the engineers to go that route. And got introduced to industrial and management systems engineering. And that was really wonderful to understand the bigger context of what a biomedical engineer could do. Through that time, I was actually working at the University of Nebraska Medical Center, and I was working with nurses and physicians and allied health and all these amazing clinicians. And I decided to add a master's of public health degree en route to a PhD with an emphasis in human factors engineering. And so that really gave me a better picture, holistic view of what can be done in healthcare on both the prevention and an intervention side.
So, what was the catalyst to make you really look at healthcare and biomedical as an engineer? As you know, there are so many different tracks you can take in engineering. In my experience, I hear like there's an impetus for a lot of people to go towards the healthcare side.
Yeah, I really did struggle with potentially going to medical school. I really always enjoyed biology, human anatomy, things like that. But I think what really solidified it for me was the fact that I could help people. And in the end, maybe it's my nature versus nurture instinct in me, but I really wanted to see something dramatic happen with people and work directly with people. So that was my impetus.
So, when we're thinking about biomedical engineering, can you describe what you're working on here with education, training, and opportunities at Montana State?
Yeah, there are very vast and diverse fields within biomedical engineering. Some different areas to focus in could be something like biomaterials. So looking at maybe the coatings of a hip implant, how do we do that well in the body? It could be the biomechanics, where you're actually looking at the physical structure and function of that hip implant. And then we also have bioinstrumentation. How can we put a smart chip in that hip implant to really understand when it's going to fail? And so those are kind of three main branches, although there are many beyond just those three. And what always interests me was kind of more that physical form and function. So kind of blending the mechanical engineering with the biology into that biomechanics sphere. I will say, though, I've really moved kind of beyond just that general design area, which designing of those is really important, any types of medical devices. Now I'm looking more like at systems perspectives. How can we create better health systems? And so for about the last 5 to 10 years, I've been working in rural healthcare. How can we implement change well? We can always implement change, but we don't always implement change well, particularly in our critical access hospitals.
And for those listeners, one of the challenges that we're experiencing in Montana is the closure and lack of access of our facilities. We have a handful of counties that don't have hospitals or access entirely. The distance is growing between these healthcare facilities, and resources are constantly a constraint. Healthcare provider shortages are in the majority of our counties. So how do we adapt on the biomedical engineering side to resource constraints?
Yeah, I think this is a really exciting time for us. We have 50 plus counties. We have about one critical access hospital. You said they are closing in those counties. Folks are driving hundreds of miles potentially to be seen for care. Sometimes our frontline clinicians are nurse practitioners. Sometimes they're PAs. Maybe if you're lucky, you have an MD or a DO. But that's pretty rare, to be honest, in a lot of our rural communities. And so we have this true lack of access, barriers to care for many folks, and also just a fear of healthcare among our rural populations. Also, our other maybe populations that aren't seen often in our healthcare system, such as our American Indian populations here in the state of Montana. But I think what's exciting is we have this giant state, right? Very geographically isolated, vast, dispersed, all these things. How can we leverage technology? And I think COVID actually really helped us in that we had to look at things differently. How can we do telehealth? How can we have, quote unquote, a doc in a box? How can we call UW in Seattle and get a consult for something we've never seen on an ECG in the middle of Browning, Montana? And so I think the doors are open, but I don't know that we're doing it well yet. I think there is a uncomfortableness for many of our rural populations to use that telehealth concept. And how do we get good data? How do we have a good impression of somebody coming in for that telehealth visit? I would say half of a clinical encounter, being a non-clinician myself, is watching somebody walk through the door. Are they smiling? Are they happy? Do they look like they're in pain? Are they able to walk through the door? And so how do we do that on telehealth is a great biomedical engineering design question.
And one of the facets that we're very interested in is telehealth, but like you talked about, this doc in a box, this modularity and adaptability. So some of the key crises that we're seeing are the mental health crises, for example, opioid addiction, substance abuse challenges. And those require discretion. Those require some anonymity within technology. Where do you think biomedical can really help us in that call to action to meet our patients where they are, but also be creative and innovative? And where do you kind of see that going?
Yeah, confidentiality in healthcare has always been something critical, right? But how do we do that when we're doing things in the home or maybe in a transportable pod in the middle of a parking lot? How do we ensure that somebody can be seen for the care that they need in a respectful and confidential way? And to be honest, that's a big challenge. It's a big challenge. I think one thing that's really changed in the device market is the ability to have really generally robust home healthcare devices, right? I can take my blood pressure at home within, let's say, plus or minus 10 millimeters of mercury. I mean, that's great. But how do we train folks or make devices better through design, robust design, so that they can do these things at home? Mental health care is a tricky one too. I worked on the Thrive project here in Montana, which was a wonderful experience. And that is like a self-paced CBT, cognitive behavioral therapy program. And that really made some dramatic impacts. How can we expand that even further? And my last point, and I'll hand it back to you, Liz, was, just infrastructure. We literally don't have enough internet infrastructure to support across this entire state. So even just going back to the basics, how can we create hotspots or places where you can be seen for this tele-type healthcare?
Are any of the students working on this, or what type of student projects do you feel are exciting to you that are really definitive of the program and are addressing these types of challenges we're seeing?
Yeah, so, in line with the research side of the house, we were just funded here at Montana State University with the collaboration of the College of Nursing, the College of Engineering, and the School of Computing to stand up a new center. It's called the BioReD Hub, and the whole idea behind the BioReD Hub is to take these three disciplines and more, and beyond just those three to start, and really look at multi-pronged design, infrastructure, solutions that will really meet this multifaceted need. So some of the projects that I'm really excited about working on is one, training our clinicians who may not have experience with electrocardiograms. How do we do those better? How can we have a rural tech in the middle of Baker, Montana, apply those correctly and have a general interpretation of that ECG output to say, oh, that was not a good read. Let's redo that because it says you're having a heart attack right now. So I think if we can just get back to the basics a little bit with things and have better training programs, maybe some just-in-time training. If you haven't done something in a while, it can walk you through those steps. So that's one project I'm working on. Another project I'm really excited about is looking at some sort of care pod that can be placed in these isolated communities. And so when I say isolated community, it's not so much just that they're rural, right? Maybe they're frontier, which I can't remember exactly the definition of frontier, but it's a very small number of people per square mile, but also isolated. If you think about Montana and our mountains and other geographical features, there really are communities it's very difficult to travel in and out of. And so could we place, say, this modular pod in an area where folks could be seen? We can have clinicians maybe have some housing right next to that pod, get some lab work done, kind of more like an outpatient visit, but then maybe also have a confidential area where we can have mental health therapy or screenings for that community as well.
And one of the great opportunities, I think, of modularity is the idea that it can be adaptable, right, to different outreach days to meet the community with whatever health-related challenges are most pressing and could be replicated. So when we're thinking about training and education, kind of a word of advice, if you will, to engineers, biomedical engineers that are looking to come in rural spaces or coming from urban to rural, maybe this is their first foray or they want to remain in Montana. What are some ways that Montana State has really equipped these engineers to be prepared to address these healthcare challenges? And what advice would you give them as a seasoned professional?
Yeah, I think, engineering curriculum is challenging. We pack in a lot of credit hours and courses that require a significant amount of time, all the way from calculus, differential equation to human physiology, anatomy. This is a lot to do in 4 years. And ABET, the accreditation body for our engineering programs, really sets some boundaries on that. I think one of the challenges is that we do a great job with our mechanical engineers, our systems engineers, and our biomedical engineers getting the basic fundamentals to lead towards that certification as an engineer intern upon graduation through the fundamentals of engineering exam. So I feel like we do fully prepare our engineers for that. What our engineers are not fully prepared to do is after they get that engineer intern credential, they haven't worked in practice, most of them. The internships that they get during those summers are critically important. Not so much what I tell my students to find the job you love, but it's also just as important to find the job that you don't like. And so those intern experiences are really critical to forming what they'll be like as professionals. Community-based practice, I'm really pushing in our graduate program. We did a complete redesign around social justice, social responsibility. How can we have our engineers work with community members to build that rapport, to build engagement, and to build something that will be holistic and lasting? Because as engineers, it's easy for us to implement a solution, but finding the right solution and doing it well is the tricky part. Moving our biomedical engineering program forward, I'm really excited to give more design opportunities, more collaborative multidiscipline opportunities, because the only way to create a good engineer, in my opinion, is to work with all of those stakeholders and those other types of engineers and architects and nurses and allied health and doctors, all those folks to understand their perspective.
And really, just to bring it home, it's that interdisciplinary perspective that's really going to help us build better. At the end of the day, it's going to take all of us. And by setting your students up for success and through those internship opportunities, that's really going to help them broaden their communication abilities, their abilities to see perspective. And that's something else that we do through our Design of Healthcare Systems delivery course, where we can have nurses and engineers work together through clinicals. They get to go into clinical spaces and be able to see with their own eye how healthcare is delivered. So it sounds like through the BioReD Hub that there will be additional opportunities for these biomedical engineers to also have those opportunities to see healthcare delivery truly from start to finish.
One of the reasons that I wanted to work in healthcare was I did get to do those observations in the operating room, in the emergency department, in intensive care, and it made me appreciate our clinicians so much. I have strong compassion that our clinicians need help and protection in the workplace, right? This is one of the only workplaces in which you can still receive physical abuse on a daily basis. And I never want that for our clinicians who are on call, who are working 12 to 14-hour shifts. So I really do have a lot of passion for this space, not just to protect our patients, but also our clinicians who deliver that healthcare. And as an engineer walking into, say, the operating room, It's what a wonderful opportunity to observe a highly functioning team, hopefully, do what they do best. And how can I make that tool or that screen or whatever that is even better so that they can be more efficient, more effective for a longer period of time?
And we appreciate your passion, Dr. McCrory. And for all of those listening to Designing Care on Air, this is Elizabeth Johnson. And our key takeaway today is to remember that with biomedical, the innovations are truly limitless. But it really takes that interdisciplinary approach of nurses, of architects, and engineers combined to really make it a space for all. Thanks for listening and take care.